Uba uMdaka uyindoda ekhaliphile, uyindoda esenza ngokuzimisela, uyindoda enesifiso ezinhle uyindoda engathi ayisafanelanga ukuba kule ndawo le kuyo manje sekufanele ithuthuke iyobona phambili amadlela ahlaza ukuthi anjani. Usuyidlalile indima yakhe emapheshentini bavukile babuMdaka baphila.
Usually it would be formal of me to start by saying, hey, welcome to my YouTube channel. This is not a YouTube channel.
Yeah.
This is a conversation just between two people. What makes it interesting is that it's a conversation between two health professionals. Once we start becoming formal and whatnot, then it takes away the whole purpose of the conversation, because the reason I'm sitting with you, Nguti, we've said before, we've worked together before, and we've shared ideas. And I like the ideas that we are sharing. So, Ngati, hey, let me not be stingy and experience this wonderful human alone. Let me give other people the opportunity to know you. I know you, Gutungbanel, but other people don't know you. So, if there was a new person, and he wants to find out who is Banel, what would be the best way for me to introduce you to him or to anyone that is watching or listening?
Yeah, that's a good one. Yeah. Thanks for having me over, Mr. Mdaka. So Banel is just a guy from the southern townships, dusty streets, who happened to find his way through life and maneuver through all the paths that life brings towards. I'm a simple guy, honest guy, and I believe Guti, as I'm a healthcare worker now, it is not of my own understanding, but it is through God. In a nutshell, I can say I came to nursing by default.
Not as a calling.
No, it's not a calling, definitely. No. It's a default in a sense, Guti, while I was still young, as having dreams, aspiring to become someone nami, emphakathini. Nursing caught me by staff. I wanted to be a sound engineer. Yes, I wanted to be a sound engineer while I was still at school. Looking at the circumstances of where one comes from, the fees that were the parents had to foot out. Fortunately, I had a friend at that time, though we're not as close anymore, but she's still my friend, who actually introduced the idea of nursing to me. So through that all, like I can say, Guti, I found myself as a healthcare worker. I grew to love nursing. Like other people would say, how nurse kanjani? Ngisabi gazi, yabo.
Yeah.
Now I had all those fears.
Yeah.
It was like a foreign land, not knowing anyone, no nurse. Yeah, but we maneuvered and we persisted. I understand.
You say you're from the
Southwestern Township.
Southwestern Township. That's Soweto.
Yes.
You're born in Soweto.
Yes.
You're a Soweto guy.
Born and raised in Soweto. Yes.
Yes. When I went to Nabati, we are going in Makaya. We're going to see our grandmother. When are you here?
20 minutes. 20 minutes.
So you've never been like you could see before your parents moved here, could see they coming from elsewhere? Because we understand that for most people, they come to Joburg in Sebenzi, but Makaya.
The thing is, I think Soweto was established in the 1950s.
Mm-hmm.
Yeah, early 1950s, if I'm not mistaken. So even my parents were born and raised in Soweto. Yes. Yeah, so the only people in my family that I can say were not born in Soweto were people of each generation going forward. We do go in Makaya.
Go Makaya.
In Newcastle.
Oh, KZN.
Yeah, KZN.
na kwa Mayisela but ayazangazi ngokubuza but Mayisela bese bathini oh you've been consumed by Soweto so much azazi nokuthi kahle isishakazelo zakho zithini.
No, it's a valid one yabo, especially mawuzothi ebantwini nomzulu they want to know ukuthi iduko zakho ziphi. So Mayisela, uMbonambi, Gasolo, Jibela,
oh my god,
Mhayise, ukahlatshwayo,
Matalangozi
so,
bathi bakahlatshwa Matalangozi.
So that's umlando kwaMayisela and nami I can say ukuthi ngoMayisela njengoba ubona ukuthi hayi sisekhaya kwaMayisela.
No, yeah, I'm happy, man. I came to this the first time coming to see your home, and I can say, usekhaya.
Yeah.
No. There's love, there's warmth. It's beautiful. You've got a beautiful home, man. The first time we met, we were just mere comserves.
Yeah.
After training.
Yeah.
Kumbula was titrating augmentin. They had prescribed the 600 milligrams. Yeah, augmentin. I keep 6 vials. What are you doing? You to 600. I so many.
No, I get mad. We were still on the learning curve.
On the learning curve.
Yeah, it was a learning curve.
Take me through your training. You said you were introduced by a friend, even though you are not as close to that friend anymore. How was your training? When did it start and how did you find it?
So, like I was saying, from stories Kamgani, initially where it started for me, those ways, like those days I won't forget because I had this friend who, for some odd reason, bekahlala khuluma ngenursing around me.
Were they a nurse?
No, she was not a nurse.
Okay.
She was not a nurse. Besesikolweni saseMamayina. Hlala khuluma ngenursing. So I don't know what was it by default. Was it God trying to talk through this person ukuthi afinyelele kimi because he probably saw wherever he was ukuthi this guy won't have interest in nursing.
Okay.
So I think it happened for like 4 or 5 occasions up until it got to me and I'm approached because she wasn't telling me. She was telling her
other
friends.
people. Okay.
Yeah, she was
Uguti
telling her
yena,
friends.
she wants to do nursing.
She wants to do nursing.
Okay.
They must go nursing and stuff. I think the older sister was a nurse at that time. And then, yeah, she was just selling nursing. Yeah, if nursing being the ambassador, yeah,
she was a good ambassador.
I'd recommend that person because one day it got to me. I was like, okay, let me ask her. Sure, girl, I'm ukhuluma ngenursing. Please tell me more, yabo.
Yeah.
Ngitshela ke ukuthi no in nursing there's bursary opportunities. You can, like, the state can fund you to fund in nursing at the same time get a salary. And it got to me. That's all I had. Ukuthi yeah, ngiyafunda ngithola isalary. Hayi. Ihuphi ndawo le? I didn't even know any nursing school at that time, yabo. Ihuphi ndawo le? She was like, no, there was open day this coming weekend, ne? Okay. I got to wake up one morning. Yabo njengoba ngithi umfana seSoweto. I was bengikhula ko 3-roomed house, yabo. So mangithi 3-roomed house, shoot there's 1 bedroom.
Okay.
There's a sitting room.
Yeah.
There's a kitchen.
Ningaki.
Fortunately at that time bese 2. But while I was younger besasebaningi nyana, yabo.
Okay.
So when people find their ways uzophuma. So fortunately bese nginomamami nami uma olady ulala ekamereni.
Okay.
Mina ngilala sitting room. Yabo?
Yeah.
Makavuke ngo5 ngo6.
Wonke umuntu uvukile.
Wonke umuntu uvukile ngoba uyahamba uyovula igate.
Yeah.
Yabo? So uyandlala lapha mattress.
Okay.
Thathu mattress. So one morning ngavuka fine. Saturday morning because angithi manje bese ngine appointment with this friend of mine. She told me, no, can we meet at Helen Joseph Hospital? So. At that time, it takes, I think it was 2 rand 50 from Emirolens to Helen
Mona,
Joseph.
how old are you when I go to the time? When you use the taxi when it was still to run feet?
No, things are expensive now. Back then, they weren't as expensive. And I'm not even talking that, how many years back? I'm talking about like 12 years back.
12 years back.
Yeah, 12 years back. It was 250. Now I don't know what Malin. Probably 12 rand 50 or 15 rand or whatever the case may be. So things are more expensive now. So ngavuka ngageza ngasidonsela ivascom yami ngizange ngatshela nomama ukuthi ngiyaphi. Ngiyazi ukuthi ngiphethe 5 rand esikhwameni. 110 yeah. Ngaphuma out. Mangiphuma gathered all my documents, yabo. Went. I remembered mangifika lapha ya mina. Open day bese iphelile. Yabo, I went to a nursing college in Lask.
Just behind Helen Joseph.
Just behind Helen Joseph, next to UJ in Kingsway. So that's when I went mangena. Yay! I saw like 15 faces I knew at that time. 15 faces. There was a guy I was very close with at that time. And then I bengimangela ukuthi ulama.
Now ufuna ukubizwa usista.
Yabantu bagqoke ama uniform mina. Ndoda ngisigqokela i-all star yami, yabona? Ijini leso skipa. And I'm like, wow, this is so formal. And ngifike unprepared. After lapho ngifike lapho. I remembered the lady who introduced me to nursing. Wangincedisa ukuthi ngigcwalise vele amaform. Wangincedisa. There was a box. Yabona lama Typex box lawo, yeah. There was a box yama application afakwa khona. Wathi letha banele ngokufakela. I was like, hayi. Ngicela ukuzifakela le. Yabo, I want to believe ukuthi ihambile kamampele.
Did you really wanted to be a nurse, or that was the option, or you were really sold?
It was sold to me. I never really wanted to be a nurse.
I'm looking at it, Gucci. Now you really want to make sure I become a nurse. I don't want anyone that from lab.
Yes. Now angithi manje I'm sold the idea. So now sengifuna ukuba sure ukuthi yazini okwami kuthunyelwa yimi. Ngithola angilekelelwa ngaloko. Angafaka vele eboxini. Fine. Sorry. It was a lengthy process to a sense yokuthi bazokubiza if back shortly still. Bazokubiza, you write an aptitude test. After an aptitude test, you then by a shortlist after my aptitude test, then it's an interview. Then by a shortlist after my interview, then again, mase bakuthathile again.
That's it,
yabo. So funny enough, in those 15 people I knew, I was the only one who was called for the whole process. No, my friend wasn't called.
Yeah,
my friend wasn't
all of
called.
those 15 people were accompanying you.
Yeah, basically. Nami ngithe mase ngibheka ngathi yo, wow.
When you come back home and you tell mama ukuthi my old lady, I decided to become a nurse. What is a feeling about that?
So my grandmother, who's now late, wanted one of her kids to be in the health space, be it a paramedic, be it a nurse. So when I came back home, okay, guys, this is what I'm bringing home. Yo, my grandmother was basically my mother. She taught me a lot. Yeah, like ngindoda engiyo namhlanje, I'm proud to say that because of imfundiso zakagogo, yabo. So she was happy, she was excited. My mother didn't expect it because I didn't tell them nanoma sengishortlistwa for into aptitude test, because there's always that room for a disappointment.
Yeah. Hey, what if
yabo? And then
bang
bang shortlist the interview. I remember when I got call acceptance. Bengamba no mama. Ne, and sengworried ke manje soku early January. Sokumele ngibone ukuthi ngiyenzani, yabona. Ngicine ngasa-applyanga nakulesa sikolo se-sound engineering ebese ngase SABC, yabo. So
alebo Banting Road.
No, it's just here, yabona, just after Campus Square.
Yeah.
Khona le res ye UJ Sophia Town.
Okay.
Just after lapho mawungena opposite ngapha.
Okay.
SABC. It's opposite ni SABC. It's Academy of Sound Engineering. Yeah, so ngicine ngasa-apply ngakhona. So now I'm like, it's Jan, what am I gonna do? I got the call, we were driving no mamame. And then ngakhuluma ngitshela ukuthi okay, izendaweni ekanje namaphepha wakho, yabo. So I had to tell her because now she's in my space, yabo. I was like, yo ma, angeke believe. Bangithathe for nursing, and then yeah, it was yabo bangithathe for nursing. And then it later on that day, it was followed up by an SMS confirmation.
Okay.
So sengifikile kasi siblomile, ngihleli nama-out. Then I got that SMS and I was like, Machita, I don't want to promise you all anything, but no, I think I'm a gone boy.
Popile.
Yeah. Ngasho, like I achieved that immediately. Ngahamba ngaya endlini, prepared my things, took them the following morning. Until today, angaze ngahlala nalabo bantu. It's not Gucci, there's any bad vibes. Masihlangana, show my chance. But I knew Gucci, this was the direction I wanted to take in life. And in order to secure and get the most out of it, I needed to do a few cuttings. Yabo. Cut those loose ends.
If nursing didn't come through, if you didn't get shortlisted and you were part of the 15 people,
Yeah.
where do you think you'd be now? How would your life look like?
Yo, what a question. It's a mystery. Because now, nanoma ngathi ngiyabheka, I'm trying to...
Pamajita. Inzana majita.
Yo, amachita. Eish. A lot of them, abanye sebashonile. Yeah, abanye baboshiwe. Abanye basasekhona, but yabo bancenga impilo. Yabo ukuthi, but I can say from that whole clique, I can say I made it out. Yabo.
Through
Nollen. Yeah, through nursing. Through uNkulunkulu, because I feel it was a path that was already made for me.
Was it Midlands that bad, man? How is Impido that? Especially for a young African man that just finished matric with no financial means to go into a higher institution. Ibukeka kanjani impilo yalo mchita loyo?
So basically, you are exposed to a lot at a very young age. You are exposed to drugs. You are exposed to guns. You are exposed, especially mozophila estradeni. Yabo. And I normally read off articles on some Cape Flats, some drive-by shooting and whatnot. Okay, fine, it's not as rife, ne?
Yeah.
But if you from that community,
Yeah.
and ufuna something better for you, automatically bazogenza feel ngathi outcast. You understand? Yeah, uzenza ngcono.
Boy.
She's boy. Yabona, they'll start bazoqala manje put it in awkward situations, maybe back to me the store and stuff. Uthi uyaphuma store uthola abantu bakumele. Yebo. So it was that type of thing. If you're not joining us, we will make it difficult for you to survive. You understand? So it was that type of background. Gyaliwa, gyaphuziwa, gyaphenywa, yabo. So at a very tender age, I was exposed to a lot of things. Though I chose not to engage in certain things, but I used to witness them happening. Pamwam.
Was it because of Uma Oledi that you chose not to?
Yeah, it's like from Ekaya, we were taught as abantwana basekhaya ukuthi uzoya esontweni uzongena endlini before light amalight hayi nango 6. Yeah, before light amalight kumele ubusendlini. You were taught ukuthi unama chores, whether umfana uyintombazana unama chores. So a certain sense of responsibility you were given ukuthi uzokhona ukubalekela life yasestradini because I had peers obozothi ngisayopheka kithi but uyapheka uyangi-understand uyangi-understand wena mawufika likumele ibhandi angeke ulala ungagezanga nanoma ungabuya umbashe kanjani angeke ulala ungagezanga. So those things when you are undergoing through zone usanokufila ngathi it's some kind of punishment kithi abangithandi plus mina bengilast born vele so bekunokufila kahle ukuthi maybe what if ngadopthiwe why mina ngathi ngitreatwa different kolaba abanye yabo. So it used to be those things but in a long run you are able to see ukuthi no,
it's for my benefit,
it's for my own good. But these people actually love me, these people actually support me, they want what's best for me. And then we realize unfortunately maso undlule through certain things wabona ukuthi wow okay bengiphila nomuntu okanje iPA yami but uyangcwatshwa okay sibanibani iPA yami but uyambophe 15 years yo wow yabo. So lezo zinto lezo they just too much.
First year, second year, now you are enrolled, you are doing your first year, second year,
Yes.
third and fourth year at Enlazi.
Yeah.
How is that for you? Hey, waqala ngesmile. Engathi I'm taking him back.
So it's a thing yokuthi like I always like I've said before ne ukuthi I came to nursing as a foreign land. It was never knew anyone.
Yeah.
Nanoma ngene eklasini shuthi ziyangidlula zonke
ama GNS.
hey ngijumpa iyo yonke into kushuthi unokuthi ukole subject okay ukole subject okay kwenzakala whatever kole subject kuba ngathi uyamuzwa umam you following no ma'am then enye subject yabo after an hour or two enye subject mina bengizwe into eyi1 bengizwe into eyi1 mina
China so
mina ngiqamba manga bengizwe into eyi1 and then now it made it difficult for me ne ukuthi nanoma ngithi ngibamba ama notes hey angithi le terminology usazama ukuzifamiliarize ayiningi yabona ngapha already abo member funa so
keep up.
Keep up yabo. So by the time I caught up my exam bayabhalwa early futhi I think September October uyaqeda clinical. By the time kuba ngathi kusuka iveil ayiko lapha engibone kahle ukuthi yo sengibhale ma 3 papers. Kana manje kuba ngathi kusuka iveil.
Oh, this is what was said.
First year wasn't a friendly one. It wasn't a friendly one. It was to a point ukuthi I actually repeated the first year. Because ngaqala course 2012. Nga repeat the first year. Nakhona ngirepeatiswa i-module A1 compulsory. So but angeke undlule baba.
GNS.
Fundamental. Yeah, FNS.
FNS.
Yeah, no memo wakhona kushuthi makakhuluma ngizwa kahle ukuthi lo mama lona ngathi angazi wenzani ivoice yakhe. You being traumatized. Kushuthi
Enemy of success. Bamthumele kimi lo muntu.
Lo mama lo wenzani. So mase ngirepeata le module kuphela. And at instances sometimes abanye abantwana base blocking.
What is that?
Block, like there's clinical block whereby niyako practical side niyesibedlela niyosebenza and then there's theoretical block.
Oh, okay.
So theoretical block size esikolweni. So siye blockini.
So how long is each block?
It differed. First year they used to give you more of a theory. Yabo. Because
so like 2 months theory.
Yeah, they can give you like maybe 8 weeks theory.
Okay.
And then maybe you go 6 weeks practical.
Sure. That's different, hey? Because Chine. Wait, so this 8 weeks, strictly 8 weeks,
Yeah.
you are in class.
You are in class.
You don't go to the hospital.
You don't go to the hospital. They feed you content.
Yeah.
Kole 8 weeks kunama assignment,
Test.
unama testi. Yabo. So
Class,
whatever
class.
thing, and then in Zobuyela maybe approximately 6 to 8 weeks na corner practical.
So wait, so another 8 weeks now, you are just in the hospital.
Yeah, you are just in the hospital. Now whatever you were learning,
You need to
incorporate
So
it
those
for
are the
practical
two.
side.
That's one of the things that we differed. We did. Maybe it's a mix. I don't know what they call it. You call it the block system. I
Yeah.
don't know. Maybe they probably have a term for it.
Yeah.
We are doing maybe Monday, Tuesday, Wednesday, Thursday.
Yeah.
We're in class.
Yeah.
Then every Friday and maybe Saturday.
Yeah.
We are in
Clinical
practical
setting,
Yeah,
yes.
clinical setting.
Yeah.
Throughout the year,
Yeah.
we have every week. There's clinical
Yeah.
hours that we have to accumulate. Okay.
So listen again. So umuntu phindi module 1.
Okay. You are repeating only the theory or the practical?
Only
Both?
the theory. Only the theory.
Okay.
Ne? But now the practical, because you are getting paid, you need to do the practical. You understand? Everything needs to be accounted for.
Okay.
You can't go a day bangas ukuphi.
Yeah.
You understand? So if this week ayikho FNS,
Yes.
it doesn't mean ukuthi it's my free
Yeah,
week.
my free week,
Ngiyahlala.
yeah.
Mele ngiyoko practical.
So the
And
whole
ngoko
week you're in
practically,
practical.
understand usase first year you are isolated. Amanye ama peers wakho asesikolweni.
Yeah.
Wena uzela ayozoba i-workforce esibhedlela. Yo. Ayozoba i-new workforce ongabelieve.
The whole shift, but I
Yeah.
know there's a student. The student myself.
Yeah. Fortunately, I wasn't the only one. There were quite a number of us. I think plus minus 20, ne? Because we had a very huge class.
Yeah.
So plus minus 20 esibhekane nalento. Siphinde izinto different. So abanye banokusurvive lento le
And get caught on another one.
and get caught on another one. I decide, I don't know what I decide mina ngiyi-one. I didn't tell my friends, I didn't tell anyone. I was like, you know what? Lento yokuyale go practical side.
Yeah.
I man ikwisa umoya wes.
How? Because we are doing your scope of practice. You're helping.
Yes. But uzoba i-workforce. You understand?
What does that mean by saying, Madela? You're confusing me.
Uzoba i-workforce.
You're supposed to go to the practical again.
Yes. So
Monday to Friday.
Uzoschedulwa
Okay.
njenge-staff esipermanent.
Okay.
You understand? You won't have into yokuthi okay.
You're a student.
Yazini ngicela ukungena ama 7 to 4.
Oh, okay.
You understand?
Yeah.
Monday to Friday and then
Yeah.
ngama weekend nami ngizoba nama peers wami because ba off block.
Yeah.
Tshela kahle umphathi ukuthi
No.
no.
Not yet.
7 to 7 uhamba nale shift le. The specific shift, yabo. So I decided on my own ukuthi let me bypass this. Try to
Yeah.
bypass this. Because now I was besengizizwa ukuthi man, yazini it's not helping me despite it. Decided on my own, abo member funa ukuthi u-account nani. Decided ukuthi hayi, awuthi ngike ngihlala iviki nje.
Just stay at home.
Yeah, ngihlale rest.
Don't go to clinical.
Yeah, I didn't go to clinical, I didn't go to esikolweni.
Why?
Because ngiyavictimizeka clinical setting. So now it's for my sanity, yabo.
Yeah.
Ukuthi nami ngizoba sane in this thing engibhekane nayo because repeating in any form is not nice. It's not a nice one. Kubhlungu. Kuba ngathi angazosuzelwe idonki or something. Yo. Hayi kubhlungu ukurepeat. Yeah, kushuthi you reflect ukuthi like ama peers wami nawa ya. Futhi ama peers wami waqeda. Yabona manje you start seeing izinto ngenye indlela ukuthi man. I wasn't a person who compare mara manje I can't help but compare. Yeah, you feel like a loser in a way. So
It's not nice feeling.
yeah, it's not nice. It's not nice. Wait up. Nanoma bangathi ufele grade 1. Usaqala isikole, it's not nice.
And it's funny because as we were coming here, I'm talking to Mtongiti. You know what? In my life, I don't think I've ever failed. I don't know the day I'm going to fail what's going to happen.
Hey,
It's a scary feeling.
No, don't even think about it. You shouldn't have a room for that. But yeah, it's a necessary process.
Yeah,
it's a very necessary process. I don't think I would be where I am or the person I am if it wasn't for that. Those situations, those moments, they humble you. Yeah, they humble you to a certain extent. You start looking at life ngenye indlela, how you treat abantu, how you talk. You understand? Because yakwehlisa. So it was a necessary one.
Yes. So we were talking about the first year, second year, third and fourth, and how was your experience? Maybe let us pick it up from here. Was nursing what you expected before you came? What's the idea other than what your friend told you? Nursing is this, is this, is this. Ufuna ukwenza 1, 2, 3. When what did you think nursing was?
Like I said, ukuthi I had no expectations.
Okay.
I knew no one over nurse. The space I was in, it was a foreign space for me at that time. Basically, as a layman person, I think ukuthi nursing based on izinto ebengifuna ukuzenza. I thought ukuthi maybe nursing was into enziwa abomama.
Okay.
Yabo. I thought ukuthi nursing would come easy. Yabo. But that first year really humbled me to a point whereby the learnership course umuntu bekakuyo had 1 repeat year. So understand again. So if forfeited the first year, gone.
So throughout the whole 4 years, you only allowed to repeat
once, yeah, if you repeat once.
Yeah.
And the second time, go home.
Okay.
Yeah, bo.
And when you exhaust that in your first year.
Yes, me exhausted go first year. And one thing ebengizitshela yona subconsciously, angithi ngihumble manje.
Yes.
So angisakwazi ukuexpressa yonke into engifuna ukuyi-express. So subconsciously into ebengizitshela yona ukuthi if I do not become lo muntu lo kumele ngibe uye after i-course mangiyi-completile, I'm not taking any other thing.
Not taking any other thing, how?
So back then, I don't know now. Back then there was a system of ukuthi if maybe i-course ikhahlela second year,
Okay.
they look at ama-modules owaphasile,
Yeah.
and then they are able to instate you. Shuthi kunama-rankings angithi kunesing.
Yes.
So there's the auxiliary, there's the enrolled, and then there's the registered. So I told myself, auxiliary, enrolled. Not that I was looking down on them. Those people have taught me a lot. But I told myself, mangayitholi lento le engiyiphumele ekhaya,
Which is professional.
which is a professional nurse. Hayi, angamane ezilimi ezitsheni. Angithathi anything.
Yuzobuyela back eMidlands.
Yeah, ngamane ngibuyele back to elokishini ngibone ukuthi elinye plan kuba yini. But definitely at that time, vision yami had been vivid to a point ukuthi I doubt ukuthi had it not worked out, I wouldn't have conformed to our standards was a strategy. Yes, so that's one thing I knew for sure. But at the same time, it had it wasn't what I expected. I thought it was gonna be easy. I thought it was gonna be, you know this thing, masculinity and feminism, or things that are usually given to men are considered superior to
What's
SP wabo mama, yabo.
Yes.
But ngithe mangifika ngapha ngaze ngathi fortunately mase repeat again, nga repeat nabangani bami ke, quite a bunch of my friends. I think half yalabantu besibloma nabo sa repeat sonke, different things though. So I told them at some point ukuthi bafethu, hayi ngathi size kuli military yabo mama la. Military.
Nursing is not easy.
Nursing is not easy. It's not easy.
People think nursing it's about just changing nappies and putting bandages.
Nursing is very broad. Nursing is very broad. To a point yokuthi nursing the way broad ngakhona.
Yeah.
It's up to you as an individual ukuthi decide ukwenzani within in nursing.
We will get there. We will get there because that's where actually ultimately the conversation is headed to, right? Fourth year, you finish.
No, second year, sharp. Now I'm
Okay.
pushing. Now it's like pumping adrenaline, man.
Yeah.
I can't repeat.
Yeah.
And ngaleso sikhathi ke second year bayenza nabantu ayabashaya. Second year pass.
Why was second year easy for you?
It wasn't easy, but the effort that I was putting in was much greater than the one I was
In first
putting
year.
initially. You understand? So it wasn't easy, but it's a thing, Yoguti. When I repeated me in the first year, no one knew. My family didn't know
That you are repeating.
that I'm repeating.
So you told them the course is 5 years.
No, I didn't tell them the course is 5 years. Listen to this. I didn't tell them the course is 5 years. Ne?
Yeah.
So, I repeated the first year. Ne? Because I didn't want, already I'm feeling the pressure. That's why I decided to omit from the clinical space. So I didn't want the pressure from different sides. And fortunately, nabo mema bazange ba notice nokuthi bengayi mina ko clinical.
How did you cover those hours? Don't answer that.
Yeah. No.
Don't answer that.
No,
Bugs.
but there was a way,
Yeah.
actually. Yeah, there were people bazi at that time. They just want to see tracker, a record.
Yeah.
Yeah.
That you are there.
Yes.
Bugs, maybe because I remember you said you have load shedding lights. Those can help. Lighting it. Nalama light load shedding.
Yeah.
Singalibekeli one la.
Bawa.
Yeah. Wow, two angazi uthi nanga.
So, bengisa explain ngithi
The years.
yes, the years.
Yeah, in the second year you are pushing more
Second
than
year sengipusha more. Seng familiar, territory, third year nakhona. Same thing. So
let's go to fourth year then. I want to
listen,
quickly
what happened?
Yeah.
Angithi manje bengafuna ukujumpa the question you asked.
Please.
So I didn't tell them what the course is 5 years.
Yeah.
They know the course is 4 years.
It's 4 years.
So when I got to third year, I actually told them, Guti, repeater it third year. Yeah. I told my parents, Guti, no. Hey, esikolweni kubhedile third year. Ngiyazi ukuthi sengiziphele ubreak leyo. Ngeke baloke bathi uyafunda. Yabona?
Yeah.
Nayo yonke leyo nto le. Yeah. Sekuyinto yokuthi nami sengiya-understand i-purpose, sengifamiliar nezinto eziningi. Sekuphampa i-adrenaline, as I said. So, third year, fortunately, nakhona umuntu waphasa.
Okay.
Yabo. Sekuyi fourth year. Fourth year was nice, actually. Fourth year was nice.
Fourth year is a cruise.
Yeah, fourth year was nice.
The combo start communicating.
Because fourth year, phela, I don't know ngani, but tina, ama subject abayi-2.
Yeah.
Mamochu.
Management.
Management uqede third year.
Human.
So wenza what's this?
Psych.
Management uqala second year, uyenza third year.
Okay.
Wenza psych, wenza community.
Fourth year. Okay.
So, not that it was a breeze totally. Yeah, I saw some of my friends by lose a globe gonjal, of course. But it's a thing, Yoguti. At that time, I'm a subject I2 theoretically, 2 practically.
It's manageable.
Yeah, it's manageable. Yabo. Though it content say more, we were introduced about DSM-5 for a psych.
Yes.
I was the type of student, Yoguti, I'm more good in my subjects. Angafuni reasoning capacity yako.
Okay.
If you get what I mean. Yabona boma anatomy and physiology.
Yeah.
Into my kanje.
Yeah. And ears and ear.
Yeah.
Yeah.
And ears ayijiki. Yabona. Angeke ukuthi it's an ear because it flaps,
Yeah.
because it what. Yang understand.
Yeah.
So those were the subjects I was more
Comfortable.
stronger go, if I can put it. Nasesikolweni into efana ne-maths because i-formula mawuyibambile,
Yeah.
you can be able to figure out whatever sums, whatever. So those were more of my strong points. into efuna ukuthi ureason
critical thinking, problem solving.
ureason wathi rationally bathi okay ipoint ngiyiphethe
Yeah.
but manje
Apply
leyo
it.
point leyo umele uyisubstantiate
Yeah.
yabo hey lawo ma subjects lawo ube wangikhathaza yabo
Which module had those subjects for you?
no like the one engirepeatile first year
Yeah.
ifuna ukuthi ngisubstantiate
Yeah.
beke ipoint it's half a mark
Yeah.
reasoning yakho enye half a mark khani uthola one ungazitsheli ukuthi mawubeke ipoint yakho ungazitsheli ukuthi mawubeke ipoint yakho
That's it. It will
uqedile
go.
uthole 1 point
No, it's not like that.
it doesn't work like that so lawo yabona like the subjects people would find more easy about social science yabo bekama subject mina bengijolokuyisa like bengijoloka enye into ngizibuza ukuthi ehle kwenzakala
So basically, you wanted something where you can cram, pass,
and forget yes yabona mawungangiphi cram pass and forget
Gone.
I was very abe dangerous lapho ngakutholela ne distinction uzibuze kanjani so lezo izinto
yeah.
bengiziprefera ukuthi okay you know what yeah bo midwifery abantu abaningi bajulukisile yabona
And the midwifery is straightforward.
yeah
Midwifery of a woman
mina
is
for
pregnant
me it
to
was
do
like
this.
ngiyazi ukuthi mangibambe i-process i-mechanism of labor mangibambe ini
I'm out.
yeah I'm out izinto bezingathi zijulukisa abantu analysis mina futhi ke mangivula i-question paper bengivula i-question paper ngithi question 1 hey ngithi ko question 2 ngithi mangithi question 2 ngiyeko 2.2 2.1 2.2 2.3 ngithi hey 3 ay okay 3 ngathi uyabuya yabo the content ngathi ngiyaunderstand
Yeah.
mina ngaqalela nge-question 3 go-answering paper
Yeah.
ngithi question 3 qalele yona and manje I make sure ukuthi ngilabula kahle ukuthi abomem bangadideki bacabanga ukuthi question 1 question 3 ngize nayo ngithi question 4 ngisuke ku 4 ngibheka ukuthi between 1 ne 2
Which one is
understand ngithi 2 ngithi 5 yeah understand so the question answering paper yam was always a mess in that sense there was no sequence and manje ngibheka ni marking into yakhona ukuthi okay le out of 25 le na 28 le inani okay
I'll spend time here.
mangabamba le ngazi ukuthi ngiyayazi ngibambele noma bangathi time out iphepha ngaliqedanga
So ngitholile.
chances angidabulile you understand so bengabi that predictable student in terms of that so I think nabo teacher bam like they had already established that good okay you know what this guy is actually intelligent
Yeah,
but
he focuses on his strong point.
yeah he thinks in his own way yabo yeah he thinks in his own way and it happened good okay fourth year mnandi yonke into mangiqala ngithola izinto ngithi till today basazi ukuthi ngirepeat third year but mina ngirepeat first year yabo so it was that thing ukuthi I've always been a person that's discreet in izinto adila nazo or izinto abhekane nazo yabo so ubu discreet bami it's just for my own sanity ngazifakeli pressure
Thandi prayer.
yabo ngithanda ipressure ngithanda abana ama expectations angithandi ini but in a nutshell ngithe mangiyithola inesing I figured ukuthi you know what le impression ebenginayo initially
About nurses.
about nurses and nursing ukuthi it's a thing yabo mama nani it's actually not the cause because uloko uzitshela ukuthi uyinsizwa yeah uzobona idust ngana dust
Uyindoda unjalo.
bona idust ukotha yeah uyibona iqubuka so I figured ukuthi you know what
You finish 4th year.
yeah
Right. Now you have to become a permanent workforce. The very same workforce that you ran away from first year. How is that for you? Now you have to spend your whole time, your whole 12 hours, the whole week.
it was a mess
Why?
Mess.
How was that for you? I thought you would be happy. Because mind you, as in singing that I've trained for.
It was a mess. A mess because of ini maungen. Ne? Usitshela ukuthi hayi yazi sengiqedile ngilitholile iphepha lami, everything is going to be easy now. I'm going to start to afford and whatnot. But stipend unyaka wonke. Shoot the money leyo soyijwayele
As a
leyo
comserve.
student. Yes, as a comserve. Angakatholi neyama comserve. I think balungisa izinto zethu November December. Yes. End of November December.
You still on that
Yeah.
5,000? How much was it when you started?
Aha, bese angithi manje yakhupukanyana.
Like
Akufani
around
khuphuka-
8.
Yeah, no, not 8, not 8. I remember, hey, benginamapolisi amaningi mina bese ngiready for residence. Like
And when you started taking policies with the stipend.
sengiready ngezithi so benginamapolisi amaningi. I think imali ebengiyithola at that time it was like 6.7.
Yeah, after policies take whatever
Yeah,
is theirs.
after my deductions.
Yeah, so it was 8 without the
yes.
deductions and everything.
No.
If it was to come to you.
Without the deductions and stuff, I can easily say ukuthi I could have been getting angithi phela ne-tax bese iqalile.
Yeah.
So I could easily be getting 8 point something 9.
Point something.
Yeah. So bese zithatha lezi zinto lezi, yabo? And emase zithatha it was a transition yokuthi okay, I thought after doing this everything would automatically fall into place. But no. And manje cabanga nemali ozoyithola so yi-professional. Akuse ama professional. Kusamele uthole imali ama comserve
Yeah.
before yama professional.
Now,
So
you start working. You are getting this salary. And for sure by then, you can tell, Uguti, as a professional nurse, this is what I'm going to get. As a man,
Yeah.
as a professional nurse, this is what I'm going to get. And as a man, this is what I'm going to have. How did that sit with you?
It didn't sit well with me. If you recall, ne? Because bengisasenoMqondo obu student at that time, I could easily be at work, push, past 11 to 12. Abantu bathathile amathi wabo ekseni, angithathanga ithi yami. Ne? Deliberately so. Hayi ukuthi awuthathanga ithi because you had no chance. Deliberately so. So mina sengifuna ukuhlanganisa ithi ne-lunch.
At once.
Hlale once. Yeah. Ngizophuma ngabo past 11 uyobuya ngabo 1. Mawubuya bathi thina bese sithi hayi uabscondile. Angabscondanga next. Yabona, I'm trying to buy time ukuthi bafethu. Hey. Kunzima la. Le 12 hours angijwayelanga, yabo. So I had to gradually, and another thing that impacted on that, when you in ComServe, bazokutshela ukuthi choose a suitable ward or a department that you
Want to work in.
want to work in.
And that's funny because I remember when they made us choose,
Yes.
we were working at Charlotte McClurk.
Yeah.
I've never been to Charlotte McClurk before ComServe.
Yes.
Like we never trained there, we never went there.
Yes.
And someone said to me, no, they listed the list of wards and 596 was one of them. And when I said, you said to me, I must not go to 596. Mina, I went to 596 because I did not know the reputation that ward had.
Mina phela
You came to me specifically. This guy came to me specifically. Aramuna, don't go to 596. I did not know. I did not train there. Now he was doing his
I
practicals
trained
there.
my whole course.
Joburg.
Yes.
And he said, don't go to 596. And then I did not know. But I was like, hey, bro, me, I don't care where I go. As long as it's not an infectious ward, I'll go any ward. Then later on, I'm surprised. I see him coming.
You know what happened? That's why life doesn't give you what you want.
Yeah.
Life gives you what you need.
Okay.
You understand? By so saying, Ngimina ukuthi i596 bengiyazi. Eziyabuya lapha.
That word.
Ziyabuya.
That word.
So masibuya. Already as a student besing establishile ukuthi you know what? This I'm not going to be able to tolerate. Yabo. God knew ukuthi into engisabayo. Bathi ufuna ukuyapha ngathi theater. Angisakhumbula ukuthi second option yami bekuyini. Guess what? These people had already figured out ukuthi kushota kuphi sizobayisa kuphi. Bangisa lapha bengafuni ukuyakhona.
We meet there.
Ngaba nenye resentment. I think ngihlephukele ngabo April from January. Yes, is the doors up. But the thing is I had already established ukuthi basebenza kanjani, yabo. I knew ukuthi mangizothi ngifuna into ekanje or ngifundisa into ekanje, I go to who, yabo. And then yeah, it got to a point whereby I was like, you know what, I don't want this word. And ngayiluyisa uzokutshela ukuthi incwadi engizibhalile.
Yes.
Ngirequesta out every 2 months.
And I don't understand.
Yeah. Every 2
why
months.
Is this guy wanting to leave? Aymuna, I've requested out. Why?
Every second month.
I didn't want it. Like he did not want it.
Yo.
But I understood that word was not friendly, man. Nah, that word was the staff there. They were not accommodating.
Yo.
It's those people they call Kalegilimos. I've been here for a long time, and I'm gonna do as I please. Whether you are a manager, whether you are a matron, I don't care. I'm gonna do as I please. So it's ungovernable with people that are stubborn and people that, hey, I'm sorry, man, these are my old colleagues, but they did not want to change.
Yeah.
None of them. None
There was
of
that
them.
mindset. And you know, I had a way of pressing buttons. Yeah. So I'll see, okay, you are resistant towards what I need to tell you. You know me.
As a student.
Next. So now it's my duty.
And I'm your senior.
So yes, I'm your senior now. And now I knew ukuthi ngizodila no muntu onjani kanjani. But despite that all, I didn't want to deal with people. I wanted to do what I love. You understand? So I eventually requested. There was a point whereby we in ComServe. I wrote letters. Guess what happened? After writing a certain letter, to be specific, they called me to the office. The big dogs, the managers, they like, what's your problem? I complain. Ne? After complaining, I think Uguti, okay, now at least it's Carlos Ambasuzui.
Yeah, they will grant me my request.
They'll grant me my request. So they ask me, what's the problem in that ward? I tell them the problem is this and this and this and this. Guess what they do? They remove the problem from the ward. This is yo. Yes. Yes.
They take out the problem.
They
leave
take
him
out the
there.
problem. They leave me there. I'm like, yeah. Guys, no. This is not fair. They're like, okay, because we've removed the problem.
What's next?
And the problem was the management. Yeah? They like, will actually alternate you guys since you are fresh from school to become the management. I'm like, yeah. I'm like, no, this is not what I signed up for. I did not want to become the management.
And after they removed the management, I became the acting manager.
They were like, okay, 3 months it can be Mr. Nollen. 3 months it can be you, Mr. Mayisela. I was like, no, give it to Mr. Nollen. I don't want this. I'm like, no, I don't want this. I'm like, no, I don't want this. This I do not want. It's like they are hearing your cries. 2-3 months down the line, I can feel it. There was a patient that traumatized me. in that
Wait, let
ward.
me guess. Let me guess.
There was a
Wait, let me guess.
what that patient traumatized me. Yeah.
Hey, you'll mute out this name.
Yes.
You'll have to mute out this name. Or maybe let me not say the name.
Yeah.
But she was on the side cubicles, on the isolation
Exactly.
rooms.
Exactly.
Arimane.
Exactly.
Yo. I don't want the words.
Yo. It was deep.
Arimane.
Yeah, it was deep. It was deep.
Man.
You see
And
that one?
it was a little girl.
It was a little girl. Tiny girl. Ne?
Eish.
No attitude, nothing. What traumatized me the most about that whole situation? I won't reveal everything. It's too much. That's why I'm saying it's deep. But that girl, I remember discharging her. Yeah. Organizing discharge summaries, getting her medication, it's called a TTO, everything. She was like me and you, walking out, going home. A week later, she came back. Not even a week later. A few days, 5 days, she came back. Incapable of walking. It was just too much. It was too much because there were dynamics that were happening. That girl, I think she was discharged in April, end of April. She came back in May. You know, there comes a point in life whereby you feel that, this person has suffered. It's enough.
Yeah.
There were no medication. Truly, they would prescribe medication that were not dispensed by the pharmacy. But they needed to motivate specifically for that patient.
So the hospital had to order.
So the hospital had to order specifically for her. Put her on that medication. Whatever that's bugging her is not the medication is not working. They even stop the medication. Guys, let's stop the medication. Let's stop everything.
Let's see what's happening.
Let's see
Let's
what's
start
going to
again.
happen. The patient is not going anywhere. I'm telling you, it was in early May, beginning of May. I'm just not familiar with the dates anymore. But I remember it was beginning of May. We saw that girl deteriorating slowly but surely. I left there in January the following year. The girl was still there in the
still
ward.
there.
No discharge,
From there on,
nothing.
nothing.
Nothing. I don't know what was wrong with her.
Chana, that girl, at some point, she developed a wound
Yo.
at the back
Yo.
because of she's lying.
Bed sores.
She's lying on the bed in one position, and the type of people that we would be working with, then, the instead of them doing, if there's 2 hourly turnings, maybe they would leave her the whole night. They wouldn't turn her, and because sometimes the management does not have the powers or the authority to enforce some nursing duties to be done, so she would be left there. At some point, she developed that wound. It was a big gaping wound.
And she's petite.
And she's young.
She's tiny. She's young.
When she cries, you go, money.
Yo. And when she says money, what I'm hearing in my ears is like money. Yeah. Bafethu. Yo, I was so traumatized.
And when that girl, I would hear.
That's when I decided.
I would
you know
hear
what?
in my sleep.
I don't want.
When I go home, I would hear that girl calling my name in my sleep. Just before her last days in China, she couldn't talk. I remember I would walk into her cubicle, check if she has bathed when we are doing handover. Then I ask her, Sissy, are you hungry? Hey. Are you full? Hey. Only that.
Yeah, it does
It
affect
affects.
you.
That's why
It
I'm
does
saying
affect you.
it's
Does
bad,
affect
man.
you,
Like if you're gonna take these
And
things
then you
home,
won't go through counseling.
there's no
for that.
counseling.
You won't go through counseling.
There's no
You
counseling.
won't go through counseling.
Yeah.
The thing about that whole situation, maybe the staff got tired because there's other patients. There's 23 other patients in the ward. Maybe on duty you 5, 6 at most. You see? So you need to do other duties. You need to attend to other people. It's like in school. The teacher won't just focus on you because you're having difficulties in something. She'll try to even things out amongst the other learners. I remember there was a point whereby back when she had gotten better on and off, we spoke in a meeting as a staff and we motivated each other that if this person is meant to be changed, tend hourly, given medication and what, let's do that. We'll remind each other in case you are focusing on other patients. We did that. A month or two, people get tired. Yo,
You give her food
people
now.
get tired. Yo.
You feed her now.
Yo.
2 hours later, the linen is soiled. She has messed herself up. And then if you are delegated to work in that cubicle, that means every 2 hours you're gonna be changing a nappy. Yeah. Yeah. So after you change a nape, you have to give her food. Clean her, bath her, change the linen, then give her food. 2 hours later, you're gonna have same thing. Yeah, but
And what was said about that whole situation, I think she was 13.
yeah, she was 13.
She
was very young.
13 years old. She turned 14 in the ward while admitted. And then when the parents would come, they tell you, do not allow certain family members
To come and see her.
to come and see her. It was deep. You understand? It was very, very deep. So the parents would tell you, don't allow anyone. And she thrived on. She fought that girl. She fought. But even if they can say you are getting 7 days off a week, when I'm off day 4, I'm thinking to myself, when I go back, will I still find her alive? Because the condition that she was in, it was not a pleasant one.
And it became a thing, Gucci, for another shift that went on 7 days rest. When they come back,
off, yeah.
when they come back,
see-
then before they could go,
before they can go and you can do handover, they ask you about her.
but Usisi, she's still there. It's like everyone was waiting. Even the doctors, when they're doing rounds, they're like, they wouldn't spend a minute there.
Yeah.
They're like, this is OCC. You guys know. It's still the same. And then they would pass by. Hey! It was sad. You know, if
That's something new.
if there was a time where you pray to God, take this person. That was the time. Lord, take this person. She does not, she's too young, she's too innocent to be going through so much pain. Take care. Take care. I cannot. And she stayed, Mchan. She stayed. By the time she passed on, no one cried. Even the father came, we called the father, the mother, no one cried. The staff, no one cried. People were relieved. At least she's at peace now. That room, the other time I went there now after I've left Joburg, I went there, passed by that 596, and I looked at that cubicle and I remembered that cubicle will always be Rumulgasis. Then there was another guy that came, you remember, he went for an interview. They used to call him with a nickname. He used to like calling people Mfanaka. I don't know if that was after you left.
Maybe it was after I left because that patient made sure that I leave. I fought tooth and nail. There was a point I remember I took leave. You remember in December? I took leave December that overlaps to January. Yeah? I took leave. Sent another letter. I think maybe it was a 6th letter. Sent another letter to my manager. I sent another letter that I want out. And where I want to go, they're actually waiting for me. They are waiting for me. They're like, no, tell your managers to release you. We are more than welcome to receive you as ours. When I was on leave, I started coming back. I remember telling my spouse that, you know what, if I don't deal with this the best way I know how, I've been formal, I've followed protocol, I've followed all channels in the correct manner. Nothing was granted. They want you there because they see you are capable. But now I've become immune to this thing of 12 hours shift. Okay. Now at the time I'm dealing with it. Now I'm like, okay, I'm on leave. Let me go to the head of the hospital. I'm on leave. I came on my casual clothes, sporty. See? Knocked. She's on the phone. Came, I sat down. She's probably thinking, who's this boy now? Someone is gonna mug me in my office. So when she hung up on the phone, I was like, sorry, ma'am. And I'm sorry and so. I work in such a place. I'm here as one of your staff members. I'm currently on leave. I just wanted, because I've been told that no, when the next group of comsevs come, we'll release you. Ne? But I had written a letter before going on leave. I knew that letter was shoved in the bin as soon as I walked out. So I fetched the head of the hospital, told them my grievances. I was like, ma'am, if I come back on leave and have to go back there because I was promised this, best believe I'll resign immediately.
I'll remove myself.
Yeah, I'll remove myself. She was like, who are you? I introduced myself again. She looked at the list of the people who have requested. My name was not there. She was like, but your name is not here. I was like, ma'am, I spoke to so-and-so and so-and-so. So if my name is not there, please relay the message to them and tell them that I'm not coming back. I'll leave immediately. She made phone calls. On my way home, I got a text from Mr. Mdaka. Hey, Bafo, ngizwa bathi uyahamba. I was like, that's it. That's what I wanted. And I left.
How was your time in theater?
My time in theater, my time in theater was the best in my career so far. That's the time I actually reflect on. I'm not in a theater setting now, but
You miss it.
I miss it. Yeah, that's where I felt I was growing. That's where I felt I was excelling. Yeah, like it was something else. It's a different type of nursing.
Briefly, tell me what happens as a theater nurse. What is your role as a theater nurse, and what things do you come across, and what makes it nice in that environment?
So your role as a theater nurse, you ensure you're still a nurse. You advocate for the patient.
Okay.
So you'll know on such a day, these are the patients we have on the list.
Okay.
This one is here for this. This one is here for this. You just ensure that everything that's pertaining to that procedure that you're going to be performing on that specific patient, it's well organized. Be it there's reps and stuff, you liaise with those people. How far are you? The patient is about to go on the bed. Are the sets that you require, the hospital sets, are they sterile? You liaise with your people that are going to be assisting you. Guys, let's do this. To a point whereby when I got to theater, a case that would take about 2 hours plus, I was able to finish it in 45 minutes.
To finish.
Yeah, everything.
So
In and out.
would it be correct to say that you are more like a coordinator?
Yeah,
You've
if you
got the
can put it
doctor,
like
you've
that.
got
Yes,
the
you've got
doctor,
the
you've got
doctor.
the instruments guys, those
The
are the
surgeon
reps.
cannot operate without you.
In terms of what? That's what I'm trying to find out. What is so important other than organizing everyone? Say now you've organized the
Yes.
person that comes with the tools that are needed. You've made sure that the doctor is there or the surgeon is there. The supporting staff is there. Other than that, which is organizing and coordinating everything, what else do you do there?
Okay. A typical example I'll use now is the one I was saying when I got to the ward. I used to maybe leave the ward at past 11, come back at 1. In theater, when you do that, nothing happens. Everyone will wait for you.
So the procedure cannot start. If there's a
The procedure cannot start. Even if it starts with someone else scrubbing, but best believe when you start familiarizing yourself and being comfortable, there's certain surgeons early in the morning that will be like, I want Banel. For this case, I want Banel. So even if it can be someone else, I decide to leave for an hour, 30 minutes, an hour, 15 minutes. That person, when I come back after an hour, 15 minutes, they haven't done anything. They'll tell you.
What does a scrub nurse do once the surgery starts?
The scrub nurse is an advocate. There's certain decisions that surgeons can be able to perform on the patient while they are asleep. Remember, there's anesthesia.
Yeah.
Or the anesthetic nurse decides to, or doctor decides to do something, but you can be able to tell them that, no, don't do that.
Is that based on the knowledge of the procedure done or based on your theoretical knowledge you've accumulated in college?
No,
or you get it?
It's
theater training.
It's more based on the practicality of the knowledge that you have acquired. Because when you get there, you're gonna be shaky and stuff. But when you be like, no, this word, I've seen it. This procedure means that we're gonna do the 1, 2, 3 on the patient. So you can't decide on your own. I'll make a typical example. Let's say the most simplest procedure is a cesarean section.
Okay, yeah.
Delivery, Caesar. The doctor decides to do a Caesar on the patient. The patient has 4 or 5 babies. She's still maybe like 32, 33. Then the surgeon decides that, no, let's close her tubes. Let's do a bilateral tubal elongation. Let's close her tubes so that she doesn't get more things.
Babies.
But I have verified the consent with the patient while she was still awake. And that thing was not consented for. So we can now decide on the
because the patient is asleep.
Based on the patient, because on her being asleep.
Does that happen a lot, whereby doctors decide to take their own routes,
people
take their own
chances.
decisions?
People take chances. Yes. So if they can see that this person doesn't know much, let's try bypassing. You understand? Let's try bypassing. Some things are unforeseen.
Okay.
Yeah? Some things are unforeseen that they'll need to take a decision on the table. But it is my responsibility to tell them and tell the people assisting me to go and call the family members, husband, spouse, or whoever, to consent for this telephonically rather, because this person cannot decide on their own.
Can't doctors
but I
do
can
that?
do what?
Pause. Go and call the family. Or because they are in a rush to finish a
the
consent.
surgeon cannot leave all the instrument. Remember, this is a sterile field that we are working on.
Yeah.
So they can rather instruct an MLO, intern doctor, a doctor that can run and make sure that those things are organized.
Okay.
Rather than them themselves. Because if you unscrub, I decide to unscrub, then the whole set and instruments have to be changed.
Yes.
Yeah, you get instances whereby we close the patient for like 3 hours.
Waiting for what?
You'll be waiting for sets or whatever the case may be. The company, the doctors didn't contact or confirm with the company that a rep is gonna come. When they call the rep is still sleeping. Hey, Adlala, the rep is still
Who are
sleeping.
these reps? Are they nursing or health professionals, or they can call him
Depends. It
to
depends.
become a rep
It depends. There's people who don't have a background.
in health?
Yes, in health, they can become reps. But mostly they prefer people who have the knowledge already. Yes, it depends.
Okay, so from theater, where to?
From theater, I'm like, hey, this job is unguaranteed.
You've got commitment issues.
Yeah, no. I do not have commitment issues. So the thing is, my life. Remember, there's a work-life balance.
Okay.
Yes, there's a work-life balance. So my life is producing in another way that my work cannot keep up.
Okay.
Not that my work. I mean that. Not that. My life cannot keep up to the work. No, the work cannot keep up
with
to
your
the
life.
life. Yeah. So at theater, I was working straight shift 7-4, work one weekend a month. Not even a weekend, maybe just one day, Saturday or Sunday, you'll choose. You meant to knock off at 4.
Okay.
Procedure can complicate. You can finish operating on the patient. There's no ICU beds.
You have to wait.
You have to wait. Wait from maybe latest you can finish that case, it's 8 o'clock. Wait for ICU bed till another 4 or 5 hours. End up knocking off at 2:30 a.m. At 7, we are still expected to be there. So now I've got a new member, family member. I need to spend time with my family member. I try negotiating with those things. You see, I've always been civil. I believe, I'd like to believe I've always been civil.
You are not abrupt.
So I've followed the channels of communicating with those people that, okay, you know what? The department that I'm in, I'm very good in all those. You can get me on any day. I can sleep. Wake me up at 12 and be like, here's a case. As long as it entails bones,
That's you.
I finesse it. I finesse it. From the foot to the spine to the trauma to the elective surgeries, I finesse it. So it's a thing whereby I got to a point whereby I was like, I'm not spending time with my family. My family is growing. I'm not spending time with them. Fine, the money is good. Very good. But I don't even get time to spend that money.
To enjoy that money.
So I decided that no, I need something lighter. I need a setting that's more friendlier. And I went to a clinic, primary health care facility. I got that. But now the problem is the money. You see? Now the problem is the money.
Yeah.
Now I'm used to these monies. Yeah, you wake up on a Monday morning not expecting anything. Poke something in your account
As a theater nurse.
as a theater nurse.
But now
See,
with primary healthcare specialist, there's
now-
nothing like that.
Now it's not happening. So now decide low coming. But I can feel my body is not coping.
Yeah.
Yeah, my body is not coping, honestly. So after not coping, I was like, you know what? You cannot finish all this money in this world. Most important people are my people.
Yeah.
Had a friend who convinced me that no, come to the blood bank. It's more friendlier.
So now you are, as we speak now, you are a blood bank. I don't know, what do I call you? What's your occupation there? Are you a blood bank nurse?
Yes.
That's what it's called?
Yes, I'm a because we work with donors. We don't work with patients. So
Okay.
we work with donors. So I'm a donor care officer now.
A donor care officer. How do you get there? When someone wants to become a donor care officer,
Yes.
how do they get there? What is required? What are the minimum requirements, academic wise, experience wise?
To be a donor care officer, mainly they're looking for professional nurses.
So
Yeah, you can't be a donor care officer without being a professional nurse. So
okay.
they want professional nurses. So
The 171 wants the new curriculum.
there's other posts for them. There's
Okay.
on-roll nurses, there's phlebotomists. So there's posts that can accommodate them, but I don't think you can become a donor care officer with the requirement basic R425.
What do you do there? As a donor care
Care officer.
officer.
So basically, you ensure that everything in the clinical setup
Okay.
runs accordingly.
You are too broad. Do you understand what a donor care officer is?
So you're a supervisor.
Yeah.
You ensure donors needs are met.
Okay.
You ensure that the company is able to get what's expected from the donor.
Okay.
You understand?
So, yeah, let's work it
You
this way.
are responsible for facilitating
What?
that whatever you have gotten from donors,
What are they donating these people?
they donate red cells,
Okay.
which we call whole blood. So whole blood is your
So these are the blood donors.
blood donors.
You are speaking to me like I know this thing, and I'm confused now.
It's not organ donation.
Oh, okay. I'm thinking
it's
kidneys.
blood. No.
Okay.
Blood donation.
So now wait, come, bear with me. I'm a slow learner. Me. I'm a slow learner. Me.
Locals joking.
I'm telling you. So you are working in a company that
Yeah.
focuses on receiving blood products
Yes.
from who? Who are these people that are?
Donors, blood donors.
And who can be a blood donor? Anyone.
A blood donor can be somebody from the age of 16 going above, living as a safe sexual lifestyle, less risks and behaviors. You should weigh above 50 kilograms. Should be in good health. And when we assess you, your blood pressures and your iron levels should be within the accepted ranges. Of the blood bank.
Okay. So as a blood donor officer, you receive this blood, or you receive this blood product. So that is, you said it's red cells.
Yes, it's red cells mainly, but red cells, it's like getting a bit of plasma and platelets. But there's strictly FRSS donors who donate plasma or plasma and platelets.
Platelets. Oh,
Yes, so you can choose to donate those products and still retain your red cells.
Oh, so you can choose specific. No, take the one and leave this.
Yes.
What are the channels there? How far can you grow in that aspect of nursing, or being a donor? A blood donor office.
Blood donor.
Yeah, that's the highest. What channels, or what rank, or what? What's your career progression like there?
It depends on your prospects, on what you are looking at. So you can be hired as a donor care officer. There's people who are supervisors, which are the unit managers in hospital setting. There's collections managers, which are like your matrons in a way. So you're a collection manager, you are responsible of a branch, a few sites that you are responsible of, and then you still report to the zone manager. So you can still get to the highest level with things. You just need to better yourself.
So the zone manager is the highest.
No.
What's above the zone manager?
What's above the zone manager?
Who does the zone manager report to?
The zone manager reports, I'd like to believe that they report to the board.
Oh,
The
okay.
board that reports to the CEO. So you can go as far as the CEO, actually.
Are you looking to progress along those lines, or you still gonna you headed somewhere?
I recently discovered new knowledge that I can actually branch out of this. So that's called the collections.
Oh, okay.
Yeah, it's the collections because they collect
The blood
blood.
product.
Yes. So that blood needs to be taken to the lab, tested, processed evenly before you can be able to transfuse it
to
in
a
the
patient.
yes.
So there's still more
The
steps.
quality needs to be checked. So there's people in the technical side, blood technical thing, people who work in the blood bank who go according to requests that Leratong needs so much units. You've seen doctors ordering blood and stuff. So based on that request, it's taken to the blood bank in the hospital. The blood bank liaises with the processing side, you see. So that unit to get there, there's a lot of dimensions that happen.
And
There's
that's where
it's stored, there's where it's traveling, there's drivers and stuff. So I've recently discovered that with the courses that I've done postgraduate, I can actually become a medical liaising officer.
what courses are those? What did you do? A postgraduate.
I did your basic courses like your NIMART,
Okay.
dispensing courses. So they just need someone who has additional knowledge, on
and then
the most the theoretical side of nursing. So with those courses, apparently I've recently had, like as I'm saying. So I wasn't aware. Yeah, I wasn't looking into going into that, but at least it sparked something in my mind.
Okay. This is where you are at. We are about to wrap this up. I have two more questions for you. Right. Are you happy now as a nurse?
Happy in what sense?
Are you a happiness? Are you happy?
So one thing I didn't mention, one thing I didn't mention, it's funny, everything comes in full circles in life. When I repeated my first year,
Yeah.
I got to a point whereby previously I wanted to do sound engineering.
Yeah.
But I got to a point whereby I get introduced to people within nursing that do music.
Oh, okay.
Yes. So I was introduced in that sense, which you can be able to rock this thing.
Yeah.
Yeah. So now I don't think my vision is narrow-minded. I'm a family man now. And it's not a thing with nursing, how further can I grow? Actually, I want to venture in other aspects, other things that I feel which I'm actually good at, despite my profession. I don't want to work until I'm 50. I hear people say they want to work until they are 40.
You don't want to preserve your pension.
I don't want to. It's not a priority to me. Yeah, it's not a priority. There's certain things that I'm good at. There's certain things that I'm currently working on now. I've got my own practice. There's a business that's running up and about. It's just that I've just asked someone in my family to oversee. But time and again, I'm aware of what's happening. That's outside health.
Outside health.
Yeah, that's outside health. So I want to get to a point whereby I can be able to say, okay, I'm leaving my job and
Focusing on this.
focusing on
Do you think
other aspects.
there's ever going to be a time where nurses in general will ever say, yeah, we are well paid? Especially in the public sector.
I don't think so.
Why?
You know why? As I initially started my story, nursing is conceptualized as a female thing.
One, yeah.
Yes. So because females have been oppressed, despite that they can feel with, hey, womandla, hey, feminism, women are still oppressed. You understand? And you can't oppress people. They're not oppressing them as they used to before. Back then it was brutal. Now they are using mechanisms,
Sugarcoating.
systems. You understand? So because they know what women are resilient forces, imbogoto, they always stand their ground. They know what they've got kids to feed and stuff. If every nurse can decide to say tools down today, we'll see our country shake. Not even our government, our country. But then women, because it's female dominated, women don't have that thing. Yokuthi siyayekela. Ingane zizodlana. Yangithola. So because of those things, and they know they're manipulating the system, which okay. I tell you, I was a public servant for permanently I was a public servant for 5 years. You know what our leadership does? Maniqale ngathi ni aggrieved babona ukuthi ngathi khona something yazi bayenza.
Yeah.
Ngeni imali engazi-understand and asingeni kuwonke umuntu. Asingeni kuwonke umuntu.
Uniform allowance.
Bayandivide bayazi ukuthi okay naku ngathi sekunomsindo bathi da kwabanye abanye yabona kusho ukuthi laba abangabanikanga minority basale bayabuzana ukuthi manje sizoyenza.
Manje nina nathula ke.
Yeah. Laba batholile bathi lesawara. Yeah. But jumper this year, next year. Baba. Those things are not things that we should be accepting. Those things are not honest.
It's a divide and conquer technique.
Yes, it's a divide and conquer technique. So, you know, Baba. I was expecting next. Ubona kahle ukuthi yo, sidonsa kanzima, bathi fa
800.
bathi fa
200.
Juthi bayenzani? Bayan come down. Eyo government obuhlungu. Yabona njengoba kuzoza ama-elections. I'm telling you ukuthi from next year ama-elections maybe bangathi angu April.
April, yeah.
Yeah, April ne. Yazi bazoyenzani? Bazonidonsisa kancane ukuthi niyifile lento. Ndonse. Sathi nakwata bathi March first week ingena imali. Next week i-payday ingene. Angithola. Shooting ngeni ezinye imali nanoma uthi ye-HR nase-HR abakwazi ukuphendula.
Bathi bonke bazitholile.
They don't know. That's the thing. And that's when I was like, you know what? If I can say my government or whatever, I've been taken to school by these people. I respect them. My loyalty lies with them. But khona ezinye izinto engeke ngizitolerate. Lezi zinto zi-affect life yami personal ufika kanjani endlini untshela unkosikazi ukuthi hayi ngiyaphetha
Ilele imali abangiholela yona.
nayi imali engiyitholile ufika kanjani? It's not ukuthi silapha esifuna ukuba khona because siyathanda. No, that's not the case. So we need to come to into as individuals of being able to think independently and when necessary sikhona ukucabanga as a group. I'm telling you one thing. Kusasa lokho kusasa. Mawangathi amanesi wonke awavuki. Ngabona umhlolo. Ilanga liwani manje angeke because nalabo bako management batheniwe ukuthi ongazanga mnikeze unpaid leave yena ugijimela emsebenzini uyongena early futhi an hour before in case maybe you strike or whatever the case may be. No.
So what will change for these conditions to change, baba? Sifaka amadoda abe maningi because women are being
Not even.
What
Tina madoda sinokuba nenkani lapho ku unnecessary khona.
So we should accept the status quo that women are
You
underpaid
shouldn't
and nurses are
accept
underpaid.
leso status quo.
What then will change?
I think that's when kungena i-role yama-unions.
You think those people are advocating for us?
They're not, because nabangithi bayafumbathisa. They're not.
So kahle nursing is doomed in South Africa.
It's not only nursing. It's also policing. It's also into. Into. Amasoja. Everyone is doomed. You understand? Mangathi nina niya complain. Le imali lezo unokuzimangalela nawo. Zingena kolaba.
Babuye bazobopha nini?
Then babuye. But hey, national crisis. Bafethu. Senishawa amaphoyisa estradini. Nithi nifundile mara banidonora ngama-donkey piri. Anibamba ngama-rubber bullet. So these people, they know how to play their cards. But the unfortunate thing, umuntu udaki ubhayizisa udaki. That's just the unfortunate part.
The last question is, you said you are a family man now. You've got 2 beautiful kids.
Yes. I had not disclosed that though.
Was that deliberate? Papile. We have not disclosed good. Wow, whatever.
But I have 2 wonderful and
They are
beautiful
too
kids.
beautiful and they are wonderful. Man. I've seen them, man. Well, it's out there. Would you advise them to take nursing as a career?
Definitely not.
Ay, Banele.
Definitely not.
Ay, Mayisela.
To a point whereby my wife was like, I knows about doctor. I was like, no, I'm gonna go about doctor.
Why? Banele, nursing, it's a humbled and a noble profession. It is a profession that allows one to render care to the ill.
Or would you recommend or advise? I'm going to tell you, would you recommend or advise?
Yeah.
So I wouldn't advise. I wouldn't recommend that. Yeah, bro. I wouldn't. I don't know. Like, man.
Okay, what would be the 5 things that you would need to change before you would make it a recommendation?
Okay, listen. First things first, I can't live my life through my kids' life.
Yeah.
I can't rectify izinto ebengifuna ukuziyenza through ezabo.
Okay, yeah. That's fair.
Yeah. But in this economy, in this world that we are living in, you need something ezoba nemali. And the problem about people, we tend to think ukuthi into ezokufakela imali would be a profession that you would have to study 7 years, 6 years. Yabo. Khozoke. Why as black people are we accustomed to struggling? Why? Why should we accept izinto ezokuyenza ukuthi uphumuzwile? No. You shouldn't. Like, we must have a mindset. Yokuthi what's meant for me will come to me. Irrespective ukuthi kwenzakalani. Khona effort okumele uyifake. Don't get me wrong. I'm not saying ukuthi everything will come easy. There is effort okumele uyifake. Mara naku baba buyasho ukuthi mosi nursing school imbonisa ama-flames. Mbone dust kotha. Ngifuna ukuthi abantwana babaye lapho. Kome ngithi okay, mntanami iba udoctor. Uyazi abazali. Hey mawukhula ube udoctor mntanami, uya ko doctor uyongena ishift ye-24 hours. Since ungena ngo-7 ekuseni uyoshayisa kusasa ngo-10, akusinawo 7. 25 hours uphile kahle khanda.
Bathi nemali, abodokotela banemali.
Uyayisebenzela leyo mali. Uyayisebenzela, by the time uyithola inkinga zikumele zingaka. Uyabona ukuthi instead of giving your kids love, you give them money, you compensate. Mawungabheka abantwana bama healthcare workers abaningi. Ama-flop. Because you spend most of your time emsebenzini. You compensate ngemali. Umntwana ugcina abhema ama-drugs. Umntwana ugcina aba-unruly. We have kids today abakhona ukubulala ama-parents wabo because of that thing.
They don't have the love at all.
They don't get the love. The most important thing emhlabeni, it's love. You understand? So, despite everything, I would not recommend. Nanoma bangathi, physiotherapist, iba radiographer. Zibheda zonke lezi zinto. Zibheda zonke lezi zinto. Hayi no. Ziyabheda. Iba i-pharmacist. What? Yokuncisha ugovernment imali zozutshontsha amaphilisi. No.
Well, is traumatized. I think you need counseling.
No. There's things that we don't look at. Nah. There's things that we overlook as black people.
Yeah.
Yeah. Would you recommend the tennis? Go to Mdaka yodlala tennis. Go become a professional tennis player.
Nah, you forward.
Do you know how much that pays?
How much?
Yo.
Udlala tennis.
Yeah.
But nakhona uyafukuza.
Ucabanga ukuthi abonatal bahola malini?
But nakhona uyafukuza.
Ufukuza how many rounds?
The training to get to that level.
You grow up nayo into. You grow up nayo into. Izinto zama-sport, izinto ezifana nabo ballerina. It's not things that we should overlook. Fine, music bangathi ine hype nyana ufuya unganamali. But if you smart, umntwana mele athole basic education.
Yeah.
Akhona ukurezina. Akhona ukuhlanganisa 1 + 1 is 2. You understand? Akhona ukubona ukuthi hayi la this is not serving me right. This is not. Khona ukuba naleyo nto leyo.
Abokhokho badla imali.
Awuthemba. Dla imali la ngaphandle. We have people today eSouth Africa ngifuna nokuya abroad. Abangana matric abayenza imali eningi and abadla imali ungidlula wena. And it's not only about imali. But they have more happiness than wena.
Yes.
They have more happiness than wena. Not because of ama-dynamics wokuthi ini. Mina njengoba ngithi ngikhulele entweni the humble beginnings of Soweto, I realized one thing about isikolo mangilo ngibona ukuthi hayi ngathi asingeni yabo hayi ukuthi asingeni because ngidoma asingeni in a sense yokuthi the mindset I had there and then people in the streets can survive ngaleyo nto leyo because of into yokuthi by the time you finish everything, every assignment, every test, every homework or whatever unikezwe yona, you are being conditioned to a certain extent. You understand? So by the time uthula ufika kuma conditions wasemsebenzini ubona ukuthi hayi la kuyabheda. Mara uzitshela ukuthi no.
This is how it's supposed to be.
This is how it's meant to be. Ubabuza ukuthi ubani osho kanjalo. But no, umthetho. Uthi umthetho kuphi?
So.
No, kuyenzwa kanje. When you understand. So those people were conditioned, they were brainwashed. Now you are conditioning, we are brainwashing you. By the time una 56, awunankani. Uzobona kahle ukuthi la ma 2000 ayenzwa bangumsilo. One complainela lento because thina we had been understanding to the very same thing lento ni complainela. Mara something if I use logical sense. It doesn't make logical sense. You understand? There's just a way of making someone understand the logical sense. And once you invest your time in that path, it end up having the sense.
Yeah.
Ungathola serial killer today.
Hlase phansi.
Ebulala abantu. Uyibuza reasoning yakhe. Ama reasons wakhe will make sense to him. You understand? That's where we come in. Sithi hayi lo uyagula lo. Lo ne schizophrenia. Lo nano. You understand? Yes. Kula besifika khona sesiya intervene ukuthi no, this one is not normal. But yena ama reasons wakhe ayenza sense kuwe.
And you believe.
You believe.
And then I don't ngahlala isikhathi naye usikhathi sonke ngogcina umthemba.
Exactly. Mawungamniki chance yokuthi akuselele lama ideas wakhe uzobona kahle ukuthi hayi nami ngiyahamba phela la. Nami ngiyahamba.
Banele mina nabafethu singahlala sikhulume the whole day. I enjoy having conversations with you. It took me back to 2017, man. Thank you very much, man, uhlala nami. And I hope this is not the last time we sit down.
No,
Please,
definitely
man.
not. No,
I
definitely
hope it's not the same time. I just got a glimpse. There's still a lot that we need to unpack.
Yeah.
No, but, this is the first episode where I'm sitting with you, and I hope we're going to have many more. You'll be a regular here.
No, definitely. No. The thing is, whatever we are talking about, it's unfiltered.
Exactly.
It's not prepared.
No,
it's-
njengoba usibona nje
yeah,
Sel,
it's
so there's a
just-
lot.
yeah.
Because at some point I want us to dive into the politics of nursing. I want us to be able to compare the health system here in South Africa with other countries and how we can move nursing forward. As much as you think you wouldn't recommend it for any loved one to do it. I think and I believe there is a way we can change the status quo of nursing. There is a way we can make nursing desirable. There is a way we can accommodate nursing. If nursing is a backbone of health as it is advertised, then there should be a way to make nurses' voices heard. And this is just the beginning of it. I want us to be able to be world-class competitors. I want people nabaqabanga nursing to use the nurses of South Africa as a blueprint. There is a reason why, I think was it Canada or Australia? One of the countries that wanted Canada wanted a whole lot of nurses to go abroad, South African nurses, so it does not make sense that they want us so bad, yet we are unhappy in our own country. So we will find and we'll explore ways on how we can make nursing desirable and accommodating to the current workforce. We will describe the lived experiences of nurses to a certain extent. Guti, someone feels propelled to speak up to the government, and it starts with conversations like this to get a true feeling of the nurses on the ground. Because at the end of the day, if the people that we have appointed to advocate for us and talk for us, they're not doing the job, then I believe we're supposed to start talking. Because they're scary. They're scary. When I sit with people that are doing things that don't affect human lives directly, and the salaries that they are getting, and the emotional burdens that they are not experiencing, and the trauma that they are not experiencing as opposed to us, it is not fair. Akukho mnandi. So we will talk, we will unpack, and we will discuss this with the Nursing Care Continues podcast. Nollen, Mdaka, we are recording at night. Mayisela. Siyabonga, Mr. Zulu.
Thanks for having me over. Thanks.
Ivale mfana.